Social anxiety disorder affects millions of people worldwide, causing intense fear and anxiety in social situations. But what exactly is it? Well, in this video, we'll explore 10 must-know facts about social anxiety disorder so you can gain a deeper understanding of this common and often misunderstood condition. And make sure to stick around to the end because I'm also going to share with you a special quiz that can help you determine if social anxiety is something you might be struggling with. So let's get started. Fact number 1 to know about is that social anxiety disorder is not the same thing as shyness. So shyness is a personality trait. It can make people feel uncomfortable in social situations, but it doesn't usually cause the same level of intense fear and anxiety that people with social anxiety disorder experience, right? Because shyness by itself isn't pathological. Social anxiety disorder, on the other hand, is an actual psychiatric condition that causes significant emotional distress and day-to-day impairments in an individual's life. What we see is intense fear or anxiety in social situations where someone might be scrutinized or judged by other people. They often fear that other people will think that they're unintelligent, boring, or even crazy. They have fears of being humiliated or embarrassed, and one of the biggest concerns is being rejected by peers. So what we see is that those with social anxiety disorder often struggle with things like perfectionism and self-critical thoughts. And then all of this can lead to missed major opportunities in life because of avoidance behaviors. So for example, it can prevent people from getting promotions at work because doing so might require them to speak publicly or meet new clients. It can also interfere with romantic relationships because people are often too afraid to put themselves out there. Interestingly, research suggests that only 12% of people in the United States who self-identify as being shy have symptoms that meet criteria for a social anxiety disorder. And then on top of that, over 50% of adults with social anxiety disorder were not overly shy earlier in life. Kind of interesting. Fact number 2 is that social anxiety disorder often begins in childhood. The average age of onset is in the teen years, and 75% of those have an onset between 8 and 15 years old. So developing this disorder in adulthood is relatively rare, and it's estimated that 7% of those in the United States have this disorder. Fact number 3 that I want you to know about is that there are 2 different types of social anxiety disorder. The first is the performance-only subtype, and this is characterized by excessive fear and anxiety in situations that involve performing in front of others. So examples can be giving a speech, performing in a play, or playing a musical instrument in front of others. The other type is the generalized subtype, and this involves excessive fear and anxiety in most social situations, so not just those involving performances. And then common struggles that we see with this type include things such as meeting new people, attending social gatherings, or ordering food at restaurants. Fact number 4 is that the mini spin can be used to screen for social anxiety disorder. The mini spin is short for the Mini Social Phobia Inventory, and this is a self-rated scale that is composed of 3 items, and it identifies social anxiety disorder with a sensitivity and specificity of around 90%, so pretty good. Now, I want to take some time and go over this with you in case you're wondering if you potentially have social anxiety disorder. I also created a PDF of this quiz for you to fill out and take with you to your next doctor visit for further evaluation if you happen to score high on it. The link is in the description below. Okay, so for each of the 3 items, you're going to rate them based on a 5-point scale. 0 equals not at all, 1 equals a little bit, 2 equals somewhat, 3 equals very much, and 4 equals extremely. Now, the 3 items that you rate have to do with avoidance and fear of embarrassment, and it's based on your experiences over the past week, okay? So item number 1 to rate is, fear of embarrassment causes me to avoid doing things or speaking to people. Now, you're going to want to rate this 0 to 4 based on the metrics that we just talked about. Item number 2 is, I avoid activities in which I'm the center of attention. Now go ahead and rate this one. And then item number 3 is, being embarrassed or looking stupid are among my worst fears. Give this statement a rating as well. So now you should have 3 scores, 1 for each item that we asked about. What I want you to do now is add those 3 scores and tally them up. Now, this is where I need you to pay close attention. A score of 6 or higher indicates possible problems with social anxiety, and this should be followed up with a conversation with your doctor so that they can conduct a full diagnostic interview. Alright, now fact number 5 is that social anxiety disorder is not the same as autism spectrum disorder. Although they can have similar traits and characteristics, they're two distinct conditions. What we see is that those with autism have difficulties with learning social skills. They struggle with things such as understanding social cues, making eye contact, or engaging in back and forth conversations. Social anxiety disorder is different because these individuals are afraid and scared of social situations. So it's not a lack of social skills issue, it's a fear-based issue. They're capable at baseline of having social relationships, and they have appropriate communication skills, but they become really anxious or scared in these social situations, and this sometimes can look like autism. But the big take-home message is that these are not the same thing whatsoever. Now on to fact number 6, which is that social anxiety disorder commonly co-occurs with other mental health disorders. It's estimated that about half of people will meet criteria for another anxiety disorder, and almost 40% will meet criteria for a mood disorder. The other major thing to look out for are substance use disorders, as people will often turn to drugs or alcohol to cope with their anxiety. Stats estimate that around 13% of people with social anxiety disorder have an alcohol use disorder, 5% have another drug use disorder, and 27% have nicotine dependence. Fact number 7 to know about is that social anxiety disorder can often have a delay between the onset of symptoms and treatment. Because symptoms can be hard to recognize, they may not be visible to others or may be mistaken for shyness or introversion. It can also be hard for individuals to seek out help because, like we've already mentioned, the social anxiety causes that intense fear and avoidance of social situations, which includes seeking out treatment. One study reported an average delay of 12 years from the onset of symptoms to when individuals reached out for treatment. So there's a lot of prolonged suffering at times for people. Fact number 8 is that first-line treatment for social anxiety disorder typically involves cognitive behavioral therapy and medication. The top medications used include the SSRIs and the SNRI venlafaxine. And it's important to know that while SSRIs are commonly used in the treatment of social anxiety disorder, there's no evidence to suggest that any one SSRI is more effective than another. Additionally, medication may work faster than therapy in reducing symptoms, but research suggests that the effects of therapy tend to be more longer lasting. Therefore, a combination of CBT and medication may be the best and most effective treatment approach for social anxiety disorder. CBT can help individuals learn coping strategies and develop the skills to manage their symptoms, while medication can provide that additional symptom relief. Fact number 9 to know about is how long it takes for medications to start working in the treatment of social anxiety disorder. Typically, medications are dosed similarly to those used for depression. But the thing I need you to realize is that the response to the medication may be slower. Research has shown that 25% of patients who initially do not respond to medications after 2 months may experience a response after 3 months, okay? This means that it's important to wait longer than the traditional 6 to 8 weeks to see if your medication is working. Then it's also important to take into consideration that relapse is common after medication discontinuation, so treatment should be continued for at least 3 to 6 months after a clinical response is achieved. Fact number 10 that I need you to know about is how to manage social anxiety disorder if first-line treatments fail. There are advanced treatment options if SSRIs, venlafaxine, or CBT don't work, and there are generally 3 different options I consider if this happens. The first medication is phenelzine. This is an MAOI, and there are 4 small randomized controlled trials that show a potential stronger effect than SSRIs. Other medications that have positive trials include pregabalin and the similar medication gabapentin. Then the third option I typically consider for treatment-resistant cases are the benzodiazepines, particularly clonazepam or Klonopin. This benzo in particular has the best evidence for it, and studies suggest continued benefit for up to 1 year follow-up. Now, a bonus medication that I haven't touched on that some of you might already be familiar with is propranolol, and this is often used for performance anxiety. It's typically given an hour prior to an anxiety-provoking situation to prevent physical symptoms like sweating, increased heart rate, and shakiness. If you want to learn more about this medication, make sure to click that top video.